it's a rare disease, and it's an immunologic reaction that some children manifest after they're exposed to certain viruses. And we've known for a long time that other coronaviruses are one of the triggers for Kawasaki's disease. What it is it's this strange immunologic reaction that affects blood vessels. And so sometimes children end up needing to be resuscitated, can even get a heart attack. It's only seen in children. It was first described in 1967 by a Japanese doctor, hence the name Kawasaki. But we now know that it's been around for a lot longer than that, way before he ever described it. So this Kawasaki disease, we're now seeing increasing numbers of it in various countries. There was an alert by the Spanish Academy of Pediatrics about it 2 days ago, because they've seen so many cases. But here in the United States, we've also seen young children that are manifesting this. And it's very likely, although not yet proven, that the reason we're seeing more cases of Kawasaki's in children, this very rare disease, is because of this pandemic of COVID-19. Children that have this problem start out with maybe abdominal pain, maybe a little diarrhea, nausea. It seems like a mild illness, but very rapidly it can become extremely serious. And so you have to watch these children very carefully. The symptoms that are Kawasaki would be a fever. It would be some changes around the mouth. You can have what we call a strawberry tongue, because certain parts of the tongue kind of die off and other parts are visible, and it makes the tongue look kind of strawberry looking. You can have a red pharynx. Everything looks very red. You have skin changes, especially in the palms and the soles of the feet. You can have pink eye, but it's a very funny kind of pink eye with Kawasaki's, because what you have is it's only in the white of the eye, and then you see around the white, very, very clear white area right around the iris, the colored part of the eye. So those are things that we see in the children and that start indicating that they might be having Kawasaki's. They also can have swollen lymph nodes. So we see these kind of changes, and then the next thing that can happen is these problems in their blood vessels, including the blood vessels of the heart, like the coronary arteries, which is why this can be so serious. If you get that child to a hospital quickly, we have very good treatment that's very effective, and most children do very well, but they have to be in the hospital if they wind up having this rare type of immunologic reaction to a viral illness like COVID-19. It's worrisome. It's not a big surprise, since I had seen Kawasaki in other kinds of coronaviral infections, but it is something that doctors and parents need to be very aware is now another thing to concern ourselves with when a child becomes infected with COVID-19. It's still true. It's still true that children have a much lower risk of having any serious disease. It's just that among those 2% of children, there's now a percentage of those that end up with this weird immunologic response to the virus that can be very serious and has to be treated urgently. Disinfectants, there are many different kinds of disinfectants, and and none of them should be consumed or injected locally. That's why they're called disinfectants. They're not called antibiotics or antivirals. They're disinfectants. They're for surfaces. That being said, the things that you talked about, chlorine gas, sodium hypochlorite, and chlorine dioxide, are are things that people have to consider and that people were concerned might have been what was under discussion. So let's start with chlorine gas. So chlorine gas is a highly toxic gas. It's corrosive. It has this kind of yellow-green tinge to it. And it was actually used in World War I to kill people and to damage the enemies. So it's a very dangerous gas that gets in the lungs and it causes fluid to fill up in the lungs, and so that's bad. Sodium hypochlorite, that's what's in bleach. So sodium hypochlorite is when you dissolve the chlorine gas in sodium hydroxide. And that together is what we call bleach. And most of the bleach you buy at the store has maybe 2 and at most 4% of this sodium hypochlorite. You have to be very careful, and you should use it in a diluted manner. One thing people should never do is mix bleach, which is this sodium hypochlorite, with a different detergent that might be acidic. Because if you do that, then it turns into the horrible chlorine gas that was used in World War I. So, and that can be extremely toxic. That's why we always tell people don't mix chlorine bleach with other detergents. The last thing that we're talking about is more subtle, and people were wondering if what the president was talking about was chlorine dioxide. And that's very different, but it's also something that's somewhat dangerous. We know it's actually used topically for specific kinds of dermatologic problems that some people have, but that's on the surface. You're not actually consuming it. And there is one mouthwash that actually carries it, but you're supposed to spit it out. And it's a little bit of a dangerous product in and of itself, and you have to use it in very low levels. And what a lot of people have been pointing out is that there is a study that talks by the Genesis Foundation, and this study is looking to see if they can use this chlorine dioxide to fight COVID-19. It's not really an approved study, and it hasn't started at all, and they're actually recruiting people. What they're doing is they're putting about 0.3% chlorine dioxide into a liter of water, and they want people to drink it over 8 to 12 hours. And in comparison to that, the CDC and the FDA and the EPA have the acceptable amounts of this chlorine dioxide in water to be 0.0004%. So this would be a very high dosage of this product, which we know from old studies is actually fairly toxic. There's old research that says that it damages the hemoglobin, which is that molecule that carries oxygen in your red blood cells. It can make you anemic. It can damage your kidneys. There's monkey studies that say that it can damage your thyroid. And there's even some monkey studies that show that it can damage a fetus. So those are the 3 different things that we should think about when we're talking about this topic. One is the chloride gas. The other is this sodium hypochlorite, which, again, if you mix bleach, sodium hypochlorite, with acid, you end up with chloride gas, which is super dangerous. Please don't do that. And then last but not least is this chlorine dioxide, which is probably what was being talked about. And because there is some consideration of maybe using it as a study, nonetheless, it's a toxic substance, and none of those at this time should be eaten, consumed in any way, drunk down in any way, or injected into anyone.